Welcome to Eye Contact. I'm Leigh Spielberg. At the ESCRS Congress in Copenhagen, the European Board of Ophthalmology and the ESCRS announced the development of a new examination for cataract and refractive subspecialist experts. Applications for this new examination have been open since December of 2016. I'm joined by Professor Marie-Josée Tassignon, who will tell us more about this examination and what the qualification will mean for candidates. Welcome, Dr. Tassignon. Could you give us some background to this examination and the idea of a European Board of Ophthalmology certification for ophthalmology subspecialists?
Well, the European Board of Ophthalmology is an UMS committee. UMS is the Union Européenne des Médecins Spécialistes.
Right.
It's the same in English approximately. But it is involved in the examination of the comprehensive ophthalmologist examination. And it has now, for many years, experience in running those exams with quite a lot of success and increasing number of participants. Now, in the line of this experience that the EBO had, the last 4 or 5 years, there was the idea, why not to start subspecialty exams? We are definitely not using the term of fellowships because we think that it is more appropriate to use the term of subspecialists. Europe is not so much organized regarding the subspecialization. It's not the same than in the US
Right.
or than in the UK. And we thought that it would be a good move to start with organizing subspecialist examination, but not from the basis on, from the top on.
Right.
And that means that we would like to have as candidates those who are running clinics as senior staff members in hospitals.
Who is this exam aimed at and what are the benefits?
First of all, let us answer the first question. This exam aims at recognizing the teachers for the future fellows or subspecialists who would like to run a subspecialization. Up till now in Europe, we do have a diploma as medical specialists, but it doesn't exist as subspecialist within a medical discipline. Mm-hmm. There is a need for that, because what Europe wants is to harmonize education in Europe, in all states of the European Union. And in order to do that, you have to stratify and to structure all those subspecialties as well. So subspecialty examination aims at harmonizing education in Europe, but also supporting continuous education in Europe. This is a very attractive approach from the European Union, and this is the reason why European Board, being a member of the European Union or a body of the European Union, would like to support. So the first step that we are going to do is, in fact, the first subspecialty that already had subspecialty exams is the Glaucoma Society, right, run by the European Glaucoma Society in collaboration with the European Board of Ophthalmology. They did that organization a little bit like a pilot study in order to see whether it's worth to continue in that direction. The answer was positive. Now, when we started, we were approached by the European Board of Ophthalmology because I am involved in the education committee of the ESCRS. I thought that it would be also a very good idea to have the subspecialty in cataract and refractive surgery exam. And we decided, in combination with the European Board of Ophthalmology, to conduct that exam. The aim is to be ready for 2017, so this year, in October.
So what can candidates expect from the examination?
Well, this examination is considered to be an examination of excellence in their field of subspecialty in ophthalmology. Those who have found their career and who have moved to define their career in cataract and refractive surgery, and who are willing to play a role in educating those who would like to be educated in cataract and refractive surgery are the good candidates for this exam. So what we would like to address, the people we would like to contact and have interested and being interested in this exam are those who are nowadays senior staff members, head of a clinic of cataract and refractive surgery. And we would like to have those candidates of all the different departments, not only university settings, also general hospitals from all different European countries. This helps harmonization of education in ophthalmology, and of course also increases the mobility of the ophthalmologists, but also of the patients who wants to come to one or another country in order to be sure that they have the right approach and the right surgical treatment.
Okay. What should candidates do to prepare for the exam? Are there specific books that they can read? Is there specific reference guides, or is it sort of a basic competency which every subspecialist should have in their field?
There is a committee who took care about that and to brainstorm about that, and it took us several days to put all that the syllabus together. Of course, if in a nutshell, I would say the knowledge is the sky is the limit, because nobody can master all the different details in approaches, in technologies for one and the same case. You know as well as I do that one particular case can be treated in different ways, right, and the outcome will probably be also very good. So what we ask the candidates is to master all the different techniques that are available in their subspecialty. And this makes a big difference between a general cataract surgeon and a cataract surgeon that is specialized in cataract surgery, right, and who can deal with all different difficult cases of cataract surgery, including zonularitis, including whatever case that you can imagine, right, pediatric cataract as well, uveitis cases, glaucoma cases. So it is not only cataract that is involved, but it is also all the connections and also the other pathologies that are connected to that, right, approach of cataract surgery. So we want to have them a very large knowledge regarding surgical devices. It's not that we ask them to be an expert in femtosecond laser. Right. They have to know what a femtosecond laser is. If they are not in a center where they can afford femtosecond laser, they have to know what is a femtosecond laser, how it works, what are the benefits, what are the drawbacks. That's the most important issue. So knowing the technology, all the different approaches, how one case can be approached.
Sounds excellent. When does it take place, and what do the candidates need to do to apply?
It will take place during the next ESCRS annual meeting in Lisbon, right, on the 6th of October precisely, the day before the ESCRS. So the candidates who are interested to participate, they have to send in their CV. They also have to send in a recommendation letter by their director of their hospital or by the medical director of the hospital, not necessarily their direct chief. Everything depends about the setting. They, of course, also have to introduce a logbook where they can at least show that they have a good experience in mastering cataract surgery independently and without having supervising, and also have a good case mix regarding the difficult cases. This is very important. They have to show that they can master all different difficult cases.
So it's not only an examination of theoretical knowledge like the European Board of Ophthalmology exam, but also one that really requires independent clinical and surgical experience.
Exactly. Right. In addition to all the administrative and logical CV and logbook that they have to submit, they also have to submit 2 different videos. One video is regarding their normal approach of regular cataract cases, and one video is a video they are very proud of, and they would like to show how they deal with a difficult case.
That's very interesting. What is the deadline to apply for the 2017 examination?
The deadline is March 10. And then the committee of the ESCRS EBO committee will have the time till end of May in order to select those who meet the criteria. And those people who meet the criteria, they will be informed about the fact that they can pass the exam and prepare for that.
Thank you for joining us. For more information on this and related topics, please visit us at eurotimes.org. Thank you very much.